Wel, bore da, a croeso cynnes iawn i bob un ohonoch chi i'r cyfarfod hwn, sef cyfarfod ychwanegol o'n bwrdd ni, a gynhelir, fel y gwelwch chi, yn rhithiol, ac hefyd sydd yn cael ei ffrydio yn fyw trwy ein gwefan. Carl Cooper ydy yn enw i, a fi ydy cadeirydd y bwrdd. Ac yn y man, fe welwch chi ar y sgrin enwau eraill yng nghydweithwyr bwrdd, sef aelodau undebol yn ogystal ag aelodau gweithredol, a chyda'n gilydd ni sydd yn ffurfio corff llywodraethol Bwrdd Iechyd Addysgu Powys. It's a pleasure this morning to be able to welcome each and every one of you to this additional meeting of our board. And as you can see, we are meeting virtually, and the meeting is being live streamed through our website. My name is Carl Cooper, and I am the chair of Powys Teaching Health Board. And in a second or two, you'll see on screen names of my board colleagues, both executive members and independent members, and together we form the unitary board, the governing body of Powys Teaching Health Board. Ac fel bwrdd, dyn ni'n cwrdd i gyd-fynd efo rheolau y gwasanaeth iechyd yng Nghymru. A mae'n bwysig falle jyst i esbonio taw nid cyfarfod cyhoeddus ydy hwn bod ni yn cwrdd yn gyhoeddus. Felly, yr unig bobl fydd yn cyfrannu at ein cyfarfod heddiw ydy aelodau y bwrdd neu mynychwyr ychwanegol dyn ni wedi gwahodd i gefnogi yr eitem sydd ar ein hagenda ni. As a board, we meet in line with NHS regulations. It's important to point out, perhaps, that although we meet in public, this isn't a public meeting. So the only people that will contribute to our meeting today are members of the board, or indeed additional attendees and contributors that we have invited to support the item on our agenda this morning. But at every meeting, we always invite questions from the public, and any member of the public is able and is encouraged to ask questions for our consideration at our board meeting, and that is a standing item. And if you would like ever to submit a question, then information about how to do that can be found on our website. And so we are being live streamed this morning through Microsoft Teams, and a recording of the meeting will be available on our website shortly after our meeting today. This is an additional meeting, and we just have one single item on our agenda for consideration, and that being the North Powys Wellbeing Programme. Before this meeting, as a board, we met earlier this morning for an in-committee or an in-private meeting. And during that meeting, we considered the confidential components of the business case for the North Powys Wellbeing Programme. In other words, the economic, commercial and financial case. We had a detailed and thorough discussion, and that included items related to the financial basis and the contingency planning for the programme, the technical process undertaken to develop the preferred option, general practice and pharmacy provision within the new hub, the importance of ensuring the project fulfills the needs of the local population insofar as possible, and staffing matters and project vulnerabilities. And so at this stage of the development, the content, the detailed content of those sections are deemed confidential and therefore not discussed in detail in the public meeting that we're having now. As always, the agenda for today's meeting and the papers are published on our website, and so if anyone would like to access those, please go to our website. They are there for your reading, for your consideration. And I think it's very important as well to point out that Powys County Council's Cabinet also meets today to consider the same item. This is a joint programme, and therefore decisions of the Council and of ourselves are key to taking this forward. Also important to point out, I think, that this is also operating within a partnership environment, and the Regional Partnership Board will meet later this week on Thursday, that brings together not just the Council and the Health Board, but very importantly, colleagues from the third sector and also those that represent the interests of unpaid carers and of citizens in Powys, and the RPB will consider this and will consider endorsing the decisions that will then have been taken. And just in that spirit, it's particularly good today to welcome Nina Davis, the Director of Social Services for Powys County Council. We know Nina well, we work very closely. Nina is an associate member of our board, but also Nina is the Joint Senior Responsible Officer for the North Powys programme, and therefore her contributions today will be in both capacities as the joint SRO and also as an associate member of our board. Ac felly, efo'r sylwadau cychwynnol ac agoriadol hynny, dyn ni'n symud rwan at yr agenda ac at eitem 4.2, datganiadau o fuddiannau. Colleagues, would anyone like to mention an interest or declare an interest in relation to the item on our agenda today that doesn't appear in our register of interests? No, so therefore we move on. Item 4.3, I mentioned earlier, the standing item on every board meeting, where we invite questions from the public. None have been received today, and therefore there are none for our consideration. So we move to item 5.1, the North Powys Wellbeing Programme, and I'm going to invite Lucy to introduce this item to us, and then we will open it for discussion. Thank you, Lucy.
Thank you, Chair. And we have a short presentation to support with the introduction. As has been mentioned, today's item is to consider and approve submission of the combined strategic outline case and outline business case for phase 1 of the North Powys Health and Wellbeing Campus to Welsh Government, that being the Integrated Health and Wellbeing Hub as phase 1. I'm going to start the presentation and hand over briefly to my colleague Wayne Tannehill to cover a couple of the slides. So just move to the first slide, please. Thank you. So just by means of introduction, the development of an integrated healthcare and wellbeing hub in Newtown is a key cross-cutting priority in the RPB Strategic Capital Plan, which acts as the overarching programme business case for all IRCF bids, and the IRCF is the fund for which this particular business case will be being submitted. The strategic outline business case submission for the end of December 2025 is critical to the approval of the business case before the Senedd elections, with Welsh Government having scheduled the decision for approval to be considered at the February 2026 IRCF panel meeting. You can see the key dates just outlined below, from endorsement of the campus programme business case, which was previously endorsed, the approved Powys Strategic Capital Plan, through to submission of our IRCF bid in December 2024, subsequent approval of that bid in March 2025, and then moving through to the current stage, which is submission of the outline business case. Moving forwards, we would be looking for FBC, so full business case submission in Q3 of 2026-27, subject to approval of the SOC OBC. And it's just important to note that today's decision is based on the submission of that SOC OBC and approval to progress with that submission, and is not confirmation of funding at this stage. We would then be anticipating, following successful submission and approval of the full business case, for a potential construction start in Q1 of 27-28 and anticipated completion in Q3 of 2028-29. It's important to note that the overall programme timetable could be improved upon or maintained on track to deliver against this timetable if we are able to progress at risk for a short period in January 2026, rather than pause whilst awaiting the decision around the strategic outline case and outline business case. And we just wanted to note that here today. Next slide, please. In terms of the business case process, this slide just provides an overview of the assessment and expectation. So the outline business case asks for approval to proceed with the associated funding before significant resources are committed to detailed planning, which will be undertaken at the full business case stage. So you can see the central box here is the area of focus for the documents being approved or seeking approval today. That is the SOC OBC focusing on confirming the strategic fit, identifying the preferred option that optimises value for money, and setting out broad procurement strategy and management controls. The key questions that it seeks to address are: is the proposal a strategic fit? So does it align with organisational and government objectives and policies? Why the change is necessary? So providing a compelling rationale for intervention and case for change. Which of the possible options is the best way forwards, and does that preferred option deliver best value for money, and is it affordable? So it provides a preliminary view on the project's likely costs with associated risks. As we move to the full business case, that will then focus in more detail on procurement of the solution, contracting for the deal, and a comprehensive delivery plan. Next slide, please. This slide just provides an outline of the key IRCF objectives and seeks to provide assurance around the alignment of the North Powys integrated hub with those objectives. So you can see listed here the objectives of co-location of services to enable seamless delivery, a hub and spoke network of integrated facilities, a no wrong door principle, a graduated response, town centres first, and proportionate and planned investment, and also decarbonisation. Just in terms of the first objective, to draw out an example of how the hub will deliver against these objectives, many existing services to be delivered from the hub are currently being delivered from at least 8 separate locations, which is currently inefficient and prohibits integration. The hub will provide a local single point of access, helping us to deliver integrated pathways and supporting seamless delivery. Next slide, please. In terms of investment objectives, the following objectives have been identified for the programme, and a benefits realisation plan has been developed, which details benefits, baselines and measures under each of these 6 investment objectives. These will be further defined with detailed metrics during the full business case. So these are integrated local services, so the creation of an environment promoting seamless collaboration with all partners, removing barriers to strengthen community services, improving signposting, streamlining pathways and enhancing the experiences of service users. Innovative environment, providing safe, welcome, flexible and digitally enabled spaces that foster innovation and support the provision of services in a modern, integrated, fit-for-purpose environment. Decarbonisation, so delivery of climate adaptation approach whilst championing the use of low carbon technologies, reducing energy consumption, supporting biodiversity and promoting green and active travel for staff and service users. Flexible, sustainable workforce, so implementation of a flexible and sustainable workforce model built on collaboration to strengthen recruitment and retention, expand career development opportunities, enhance community-based training and prioritise staff wellbeing. Regeneration, so the generation of opportunities to optimise social value through stimulation of the local job market, increased engagement with the third sector, and by adopting a town centres first approach through the creation of a new community venue near the centre of Newtown, and fit for purpose estate, providing safe, efficient and compliant accommodation that improves utilisation, reduces backlog maintenance and makes best use of public sector funds and assets. Next slide, please. So in terms of what difference phase one will make, the hub will enhance access to early help and community-based support through joined up accessible services with a strong emphasis on prevention and proactive care. This will support individuals to manage their own health and well-being, helping to reduce dependence on statutory provision. And we also aim for the hub to help support us with the shift of services from secondary-based care into primary and community, which is aligned with national thinking. You can see here some examples of this, and these have been worked through our service redesign work stream, which is part of the North Powys Wellbeing Programme governance structure. That work stream is led jointly by senior council and health colleagues who are also integrated into and leading work in both organisations around organisational transformation and service redesign. You'll see here dental, so there will be an increase of dental chairs from 3 to 5, helping to reduce waiting times and avoiding people having to travel out of county for services. From a training point of view, the inclusion of a health and care academy within the hub site brings that asset to North Powys and offers continuous professional training, placements and apprenticeships, helping to attract and retain skilled staff locally and providing a unique opportunity to support unpaid carers in the region. The library will offer a welcoming stigma-free space that encourages community use and complements other services, supporting health literacy, digital inclusion and lifelong learning. And from a lifestyle point of view, flexible bookable group rooms within the hub will allow healthcare and third sector partners to deliver a wide range of wellbeing and lifestyle activities under one roof. From a family's perspective, services are currently delivered from at least 3 sites in the Newtown area. Bringing statutory and non-statutory services under one roof will create a more holistic offer for families, where staff can benefit from a closer multidisciplinary relationship. And from a primary care perspective, an enhanced and integrated primary community care offer will be delivered from the hub to ensure focus on prevention and reduce the need for people to travel for hospital appointments. And this is aligned with the National Emerging Community by Design approach. Next slide, please. I'm just going to hand over to Wayne here for 2 slides. Thank you, Wayne.
Yes, thank you, Lucy. This diagram shows the degree of proposed consolidation of the estate related to phase 1 of the North Powys scheme. Welsh Government encouraged the rationalisation of properties, which means we will be able to operate from a smaller footprint in a joined-up way from modern fit-for-purpose premises. The proposed hub will see the integration of 6 public sector buildings plus primary care, and there will also be additionality in terms of education and training facilities, an academic library and other services. The off-site premises that we vacate will also be considered for conversion in collaboration with registered social landlords as potential student and key worker accommodation in Newtown. If we could move on. The image, which has kindly been shared by Haven Aravon, gives a good aerial view of the park and identifies key partners, Open Newtown and the Oriel Davis Gallery. It's a really great visual of the activities, Newtown Carnival in this instance, and the high levels of community engagement. We're setting up and have indeed had some meetings with the Town Council, Open Newtown and Oriel Gallery to work together on enhancing the use of the external space, and particularly Plot B, which is shown on the image, to ensure this can continue to provide a vibrant community meeting space into the future. The Health Care and Wellbeing Integrated Hub will be able to add value, which will also include the potential for green prescribing in the external spaces, supported by a community liaison officer who's been appointed in the partnership space. Thank you, Lucy.
Thank you, Wayne. So just in terms of further engagement and communications, engagement in relation to phase 1 of the scheme has taken place with a wide range of stakeholders, public staff, councillors, both county and town and community, residential neighbours, third sector groups and other key stakeholders. And this is built on previous engagement work across the duration of the programme's history. It has incorporated more technical discussions in relation to some of the service redesign and also public drop-ins held and an online and paper survey with more than 280 people engaged with through those events and the online survey. We had some valuable feedback received in relation to strong support for the integration of services, some mixed views on the proposed location, some people welcoming the proximity to the town and modern building design, and others raising some concerns about heritage issues. Concerns also raised about the amount of parking proposed on site, with the programme team looking at mitigation strategies for that and how that could be developed. Some stakeholders expressing worries about reduced space for services, hot desking proposals and the relocation of the public library. And just for assurance, the programme team have been working through all of the feedback received and ensuring that that is incorporated into our current and forward planning. There's been a clear call for continuing engagement as the project progresses into the full business case stage, and the programme is committed to undertaking that engagement, both at a more technical level in relation to the future service design and system integration opportunities to ensure that we are optimising those, and also with our wider public engagement. Next slide, please. So the final slide to share with you today is just really to place phase 1 within the campus approach. So as you can see from the diagram here, phase 1 and the scope of that is the integrated health and wellbeing hub with the community resource hub front door, primary community care, children and families and mental health services. Phase 2 with the scope of phase 2 is the Rural Regional Diagnostic and Treatment Centre, including the replacement of Montgomery County Infirmary. Phase 3 would incorporate further expansion. And you can see that there's also elements of the school, supported living and student and key worker accommodation, which are also associated with the wider campus. So I will just finish there, Chair, just to say that obviously today we are seeking endorsement of the strategic outline case and outline business case, and support and approval of submission to Welsh Government. Thank you very much.
Thank you, Lucy and Wayne, really helpful. As always, it's really good to have with us today Katie Blackburn, the Regional Director of Llais, which is the Citizens' Voice body for health and social care in Wales. And Katie, I wonder if I might turn to you at this point and just invite you to share with us any perspective from your engagement with people that you think would be helpful for us to bear in mind and consider as we go into the discussion.
Diolch, Carl. I'm Katie Blackburn. As Carl said, I'm the Regional Director for Llais, which is the independent statutory body for health and social care, listening to patients' views. I am not part of the decision-making process today. Thank you for the opportunity, Carl. Just a couple of observations, really, I think, from me. I think, firstly, just to say and to be clear that Llais, as I've just mentioned, has a remit for health and social care, and obviously this project goes way beyond that from the point of view of the breadth. So that has been a little bit of a challenge, just sort of trying to work out where Llais fits with some of this. So just to make that very clear that we are only here from a health and social care perspective. I think the other thing just to say is that and it's understandable, but there has been, although there's been a lot of engagement, and I've read the engagement report, I think some of the terminology that's been used, and the SOC and the business case, whatever. I think from a public perspective, going forward, there needs to be some sort of consideration given to how some of that information is shared without using too technical terms. I think the population that we've come across has sort of often found themselves a little frustrated, not understanding what's going on, whilst there has been a lot of engagement. So I think it's about the nature of how that is communicated with the public going forward. I think it would also be quite helpful to have the timeline for the different phases. And again, I think that would be very beneficial to for the public to understand what that timeline is. And I suppose finally, from my perspective, the devil will be in the detail from a Llais perspective when we understand if and when this is approved, what the specific detail will be, what the specific changes will be, and we'll be in continual contact with the team at the Health Board to understand that and to understand the integrated impact assessment. So thank you very much. And thank you, Lucy. That was a really, really interesting presentation and was actually really clear. So thank you very much.
Really helpful, Katie, as always, and colleagues do bear those observations in mind as we go into the discussion now. Just on a very technical point, I think that the raising of a digital hand to indicate that you want to contribute may not be working. So could I ask colleagues, please, that you just indicate in the chat pane that you would like to contribute, and I'll bring you in. And we go initially to Robert Lewis. Thank you, Robert.
Thanks, Chair. Robert Lewis, independent member. Huge amount of detail here, a lot of excellent work getting us to this stage. And the big picture for me is that this project involves a major investment and is good news for residents in the north of the county. My question follows on, I think, from the previous speaker, really. It's about primary care other than dental services. Could you confirm that the intention is to provide primary care services at the site and indicate the timescales when plans will be sufficiently developed for the public to appreciate the scope and detail of such provision? Thank you.
Thank you, Robert. In the interest of time, I'm going to invite 2 or 3 colleagues to contribute, and then we'll seek a response from Lucy or the relevant executive colleague. So we go now to Ian, please.
Thank you, Chair. Bore da pawb. Ian Thomas, independent member. First of all, just to add my 3 penneth worth, really. The presentation was excellent. There's obviously been a lot of work put into this so far, and I know there's a lot of work to come. And I do concur with colleagues as well about the absolute positive benefits that this will have for the north of the county. And I want to really pick up, my question is based around that, really. And it's about some of the investment objectives within the plan. It was good to see the optimization of social value and the regeneration of the local economy in Newtown. And that foundational economy work I've seen in action can be very, very beneficial locally. And I just want to gather some, I guess, some further comments really from the team about how we are going to measure those community benefits once the project is delivered. So it's about the future benefit to the community. Thank you.
Thank you. And Jen, please come in.
Diolch, Carl. Jennifer Owen Adams ydw i, un o'r aelod annibynnol. My question, Lucy, is to do with the whole project governance, risk register, and also the role of the third sector in co-producing the eventual solutions and for this exciting project. Before I ask those questions, I do want to add my appreciation for the huge amount of work that's gone on, and my congratulations to all involved who've got this project to this point so far. It's incredibly significant for Powys, and I'm hugely excited by it, and you know, really supportive of it. My question is first of all, I really want to emphasize that the fact that we are shifting, this project is about the community-focused model of healthcare and well-being. And given that, the role of the third sector in being able to co-produce and provide solutions to what those services could look like. I can see from the paper and from the full report that there has been huge engagement with the third sector and other colleagues and stakeholders right across Powys. I really, really welcome that. Could you just describe to me how that engagement with the third sector will continue through that project governance, through those project governance arrangements, and how that marries with the risk register? Because we know when there are lots of people around the table, sometimes it is a bit difficult to get decisions and agree final solutions. So how is the risk register going to manage that? I'm just looking for that sort of assurance in terms of making sure that there is that third sector voice, and also that our project governance for this project across all of the parties involved and stakeholders can make sure that we can provide and come up with the solutions that we need to be able to realise the vision of this project. Thank you.
Thanks, Jen. So a lot there, Lucy, but just as a summary, when will we begin to see details of primary care provision? How will we measure the foundational economic impact and an assurance in relation to ongoing meaningful involvement of the third sector and the managing of risk around that? So I'll come to you, Lucy, but you may want to bring in other colleagues in the response.
Thank you, Chair. So just to respond one by one then to the questions. So in relation to primary care, I can confirm that primary care is very firmly and will continue to be firmly within the scope of delivery of services from within the hub. What we are currently working through is the delivery options for how that will be delivered, building upon the national work that's emerging for community by design. And this really gives us a very exciting opportunity to work with local contractors to be providing additionality around primary care services from the hub, not just relocation of services, of existing services into the hub. So hopefully just to provide assurance and in terms of timescale, those conversations are active currently with partners and stakeholders. There will be a specific project of work set up as part of the programme to ensure that we have the right delivery option identified for the hub, and that work is active now. So I don't know if my colleague Elaine Lawton wanted to add anything to that, if I might bring in Elaine, if that's okay.
Thank you, Lucy. So I'm Elaine Lawton. I'm the Exec Director of Primary Care, Community and Mental Health. And I suppose just wanted to reinforce what you have just outlined, we're at a point in time where we're trying to develop a building that enables us to deliver for the future and to deliver in a collaborative way where we can wrap services around our population and their needs for the future. So I think that there will be, as we move into hopefully the development of the full business case, an opportunity for us to really clearly articulate what that looks like, some of the specific component parts of that, with our primary care colleagues, particularly those in general medical services and community pharmacy. So I think we're in a slightly challenging place because we're looking 3 years in the future at the moment to being able to step foot in the building and deliver things from the building, and we're also trying to reach beyond that, sort of 10, 20 years, etc., further into the future. So I think the general focus of a community-based building that integrates services wrapped around evolving population needs is really critical. And I think I'm of the opinion that not proceeding on that basis will limit some of those opportunities for us. Thank you.
Thank you, Elaine. Chair, if I may just move to the next question. So just in relation to how we're going to measure community benefits. So you hopefully will have noted that there is a benefits realisation plan which is incorporated within the background documentation that's been provided to board members as part of the strategic outline business case submission. That is currently at a level of detail appropriate to the SOC OBC, but does include those aspects of how we will measure community benefits moving forwards. We'll be working to provide more detail into that plan as we progress into the full business case stage, and that will include key metrics that we would be looking to measure against. Just in relation to your question, Jen, in relation to co-production, role of the third sector, how we strengthen that moving forwards and the governance related to that. We have a robust service redesign work stream, and we will be looking now as we move into FBC, so into the full business case process, to develop our full and robust engagement plan, which will obviously include third sector colleagues and wider stakeholders. We're looking to build upon the engagement we've already undertaken and the structures that we already have in place. So we have an active group in which of third sector representatives with which the programme is engaged. We know that there is more that we can do to strengthen that as we move into the full business case process to ensure that we are fully hearing views and truly working in a space of co-production. In terms of governance, we do have PAVO representation on our programme board for the programme, and we'll continue to have that representation through that mechanism. That obviously that programme board considers the risk register and ensuring that we have that tracked through in that environment. Just to add, we have currently got an internal audit process being finalised for the programme, which will be considering the governance arrangements around the programme and whether there's areas that we need to strengthen as we move into full business case. So if that does come forwards with any opportunities for us to strengthen that structure, particularly in relation to the elements that you've referenced, Jen, then we would seek to take those moving forwards. Thank you.
Thank you. So Robert, Ian, Jen, is there anything that you want to comment further on, or are you content?
Content, thank you. Okay,
in which case we will go to Ronnie and Mick, please.
Thank you, Chair. Ronnie Alexander, independent member. Lucy, I'm just seeking assurance from you that we will have maximum utilisation of the facility from onset, and also that we have in our minds some flexibility built around that in order to ensure that services are provided to the maximum possible for the benefit of the local communities. Thank you.
And Mick.
Thank you, Chair. Mick Janassi, independent member. I know from bitter experience that quite often it's peripheral issues which define the perceived success of projects of this nature, and they can sometimes undermine the core benefits, and parking and safe access are prominent amongst those. I noted in the engagement piece that public concerns have been raised about these issues, and my reading of the business case is that the solutions to those depend to a significant extent on public parking, land acquisition. So just looking for some reassurance that is a problem that's being actively addressed, and that there are options if those negotiations or the planning constraints don't fall into place.
Thank you, Mick. Lucy, please come in.
Thank you. I'll just come in initially on utilisation of the site, and then I will just hand over to Wayne to answer Mick's question, if that's okay. So just in terms of utilisation, I think there are two mechanisms for which we will be ensuring full and optimal utilisation and integration within the site. So one is through the mechanism I've already mentioned, which is the service redesign workstream, which is co-chaired by Health and Council leads, who are embedded in organisational service redesign and transformation in both organisations. I think that's really important to note because they're at the forefront of the work that's being undertaken to work in an integrated and collaborative way to look at these services for the future, and the hub will be a vehicle through which we deliver that, and a very important one for the North Powys area. The second mechanism will be through technology and use of technology. So we will be seeking to embed room booking technology into the hub to make sure that we are optimally utilising this site, and that all partners are getting an equal opportunity for usage of the facilities, to ensure that we're offering a truly integrated and collaborative offer from within the hub site. Hopefully that answers your question, Ronnie.
Sorry, let's just pause. So, Ronnie, does it answer your question, or would you like to comment further?
I think it does, Chair, but from my perspective, I suppose what I wanted to do was to reinforce the importance of flexibility and agility in all of this as the process goes forward. Thank you.
So, Wayne, please.
Yes, thank you, Chair. Wayne Tannehill, Associate Director of Capital Estates and Facilities. To pick up on your point, Mick, the parking immediately adjacent to the proposed hub is relatively limited. So we've been looking beyond that to Back Lane car park, and we have had detailed conversations with Powys County Council colleagues and highway colleagues in conjunction with availability of parking there. And you may have noticed in one of the earlier images where we had Newtown Carnival in the park, and even though it was extremely busy, there was still available car park spaces there. And that's the assurance we've had from council colleagues, that there is availability of car parking. The other benefit that we will bring to bear is that we will be relocating staff from some of our adjacent existing facilities, the Family Centre and Park Street Clinic. So there is circa 25 spaces that will be available there as well, that we can bring into use with the integrated hub. And I think looking beyond that, as we look to the potential of phase 2 and the broader campus, there will be further opportunities for us to review parking more broadly as well. And when we talk about accessibility and parking, really important to note that it's about pedestrian accessibility, and we will be looking at things like cycling to site and general other means of accessing the integrated hub as well. And hopefully that addresses your question.
Mick, content?
Yes, content. Thanks. Just wanted to make sure that it was, it is a peripheral issue, but just wanted to make sure that it was, within our sites.
Thank you. I'm going to invite the Chief Executive, Hayley, to comment finally. And Hayley, you might want to offer an observation or two in response to Katie Blackburn's opening observations as well around the use of, or rather being very aware of not using jargon, the timeline for the campus, and of course the fact that once the detail of what this means to people becomes more clear, then of course people will clearly then have a view and have observations to make about how this will land. But over to you, Hayley.
Yeah, thank you. And thank you, Katie. I think that right at the outset, there's something really important for us about how we engage and how we communicate this long-standing programme of work. This has been in development for a number of years, and clearly taking this approach to the campus, which is a staged approach, which this case is the first stage, which is for the integrated hub. Clearly, we've got to follow the business case process of Welsh Government and be really clear about being open with the communities that this isn't a done deal. This isn't definitely happening until the final approval of the case comes through at FBC, which is the full business case stage. And I think it's something we've been very aware of from the start, which is, I've heard that feedback as well, Katie, is that we do need to think about how we get this across to the local communities in a simpler way, but also that we aren't raising expectations until we've definitely got the available funding and that confirmed to be able to move forward with the first stage of this campus. And I think there are broadly three elements. So firstly, what is the offer? What is being delivered in this first phase, and how that fits then within the overall campus and the ambition that we've set from the outset for this programme. And I think that in relation to that, there's some further work we need to do to be really clear with the communities. And in the example we've just discussed is around primary care. So we need to be able to articulate exactly the offer in the sort of first phase of this work. I think the other issue is around the design. So we've heard clearly from the public as well around some positive feedback, but equally some concerns, because we've had to look at this from a site development control planning to accommodate this first phase, which is the integrated hub, but also the later stages, which is the replacement hospital, and also the school is going on there as well. So when you look at that site control management of the overall site, clearly that has resulted in the need to change the overall site, particularly the impact on Park Office. And I know that that's been a point of concern in the local community as well. So that ongoing engagement and consultation has got to be stepped up now as we move through this next stage. And particularly from my perspective, the particular work with the Welsh Government around the timetable that they've set to get back to us during February around this work will be really important, so that we can able to actively continue that conversation with the public. So it's really good to hear some of the questions, particularly Jen, that you raised around specifically the third sector, but also the overall engagement and communication planning of this programme is going to be critical to its success, both in understanding the direct neighbours and what that means for them, but also that broader connection with the wider communities that we need to, which is not just Newtown, it is more broader, to being able to get the points across for this programme. So really appreciate you picking that up, and perhaps we could work closely with you again with simplified messaging so that we can get that across to our communities. So thanks for the points, Katie.
Thank you, Hayley. Felly, symudwn ni ymlaen rwan at yr argymhelliad. We'll move to the recommendation for this agenda item. And the recommendation is that as a board, We endorse the strategic outline case, the outline business case for the North Powys Wellbeing Programme Phase 1, and also that we approve submission to Welsh Government. Subsequent to approval by Welsh Government would secure the next stage of funding, allowing the programme to progress to the development of the full business case. Would anyone like to comment on that recommendation? Or would anyone like to indicate that they don't support the recommendation? Therefore, that is supported and supported unanimously. Thank you. There is no any other business, and the next scheduled meeting of our board is on the 28th of January. So that concludes our business for today. Thank you very, very much to all who prepared for today, all who've contributed, and indeed for the discussion and the decision. So thank you and goodbye.